Thank you, Hugh and George and Donald and everyone. I'm thrilled to be here. I'm thrilled to be here to speak with you today. Also thrilled to be here on campus the year, working with the team and getting to meet all of you and learning from you as well. So I wanted just as a little bit of context for this topic. I'm leading some research with my colleague, Dr. Tran Nguyen at the University of Minnesota, through an EPA-funded environmental justice grant. And the purpose of this project is to capacity build among community-based organizations to develop an in-language technical assistance program for immigrant-owned nail salon and beauty salon owners and workers so that they can make more informed choices about making safer choices about the products that they use, and also applying, through the knowledge they gain, adopting more indoor air quality best practices. Oh. Nope. If it doesn't work, it's oh great, thank you. Love this concierge technical assistance. Okay, so just by way of background, related to related to air quality in general, indoor and outdoor air has been recognized as a grave threat to human health for quite a long time. Actually, there's a large and substantial body of evidence that speaks to the cardiovascular disease risks, pulmonary disease risks, cancer, and other health outcomes. But for a long time, it was thought that the outdoor air pollution was the biggest risk. And in fact, evidence is beginning to emerge to suggest that, in fact, indoor pollutants may be 2 to 5 times more harmful to our health than outdoor pollutants. And of course, we get some of those outdoor pollutants infiltrating our homes, but we also have sources that are generated indoors. And that's really concerning because people in the developing world spend most of their time indoors, and estimates of upwards of 90% of our time. So we're vulnerable to exposures over long periods across the day and then over day to day. Sources are many and varied, and the chemical compositions of these indoor air pollutants are complex and they're poorly characterized. So we don't have a good understanding of what they are and what their health risks are. Further, the risks borne through the exposure are not evenly distributed. So people who are from lower socioeconomic status carry a greater burden. So they tend to be exposed to higher levels of these pollutants because their neighborhoods tend to be situated closer to industrial sources and highly polluting sources, because they tend to live in older building stock. So the composition of the building materials and the design of the homes and the conditions of the home tend to lend themselves to greater levels of pollution. So this makes the indoor air quality an environmental justice issue. So why are we looking at low-cost sensors and citizen science in this project? Well, as the name implies, low-cost sensors cost less, and therefore, if we can work with low-cost sensors rather than research-grade sensors, that can remove barriers to purchasing instruments. And so we can take that same $5,000 that we might put towards a TSI instrument like a Q-Track, and buy 15 of these low-cost air sensors that allow us to make similar kinds of measurements. And in fact, evidence suggests that the low-cost sensors deployed through citizen science may give us more representative data, and they may provide better capture spatial and temporal variability, because if we can deploy more of these sensors and have people in the community using them in their own respective spaces, then that allows us to cover a lot more ground than one research team trying to go school to school to school or house to house to house. It also allows, we believe, through the use of the citizen science, approach, it can help us democratize the data and the knowledge generation. And the reason for that is that when we use a citizen science approach, people within the community they're part of the process. They're helping to identify problems. They're ideally coming to the science team and saying, can you help us understand this issue? Can you help us generate data to build evidence about this thing that's really important to us? And in engaging people from the community in that process, from environmental justice communities, we empower those communities because they not only understand the data, they own the data. They help generate it. They can articulate the evidence, and then therefore they can advocate for themselves with policymakers to bring about necessary changes. And then there's also some evidence to suggest that it increases science literacy. And this is one of the things that I find really compelling and was really motivating for me, because in a time when there's so much science skepticism and backing away from kind of evidence-based actions and behaviors, I think anything we can do to help build science literacy in the world is worth doing. So the goal of this work for this environmental justice project was to develop best practices for using these low-cost sensors specifically in environmental justice communities using a citizen science approach. As part of our activities to achieve that goal, I'm going to talk about two of our activities. One is the evaluation of a range of low-cost sensors. And I'll just mention this isn't a comprehensive evaluation. It's kind of a case study that was specifically tailored for our needs, but it's actually pretty representative of what you'll see reported in the literature. And then we're conducting, it's a work in progress, scoping literature review to get a sense of the state of science around citizen science as it's applied to indoor air quality. So the first part, I'll talk about this evaluation, and we were very fortunate to have a graduate student in our program, Tim Nguyen, for whom this issue was very near and dear to his heart because his family owns a nail salon. And also, he was trained in the services that are provided at that nail salon. So he had a good understanding of the tasks that were involved in the work. He understands the work environment. He speaks Vietnamese. And so it was very, very helpful. And also, he was getting his master's degree in industrial hygiene. So it was a great fit. From this picture here, Tim was in our exposure chamber doing some preliminary work to scope out his study design. There is some guidance. I think there's kind of some general, I think we can say consensus around this terminology. But when we talk about low-cost sensors, sensors that cost less than $300 are considered ultra low cost. Between $300 and $1,200, again, US, this is considered low cost. And then sensors that cost more than that are considered more conventional research grade instruments. And we use that framework for our study. And so we selected 6 sensors for this study. Our priority was to have sensors that could measure both volatile organic compounds, or VOCs, as well as particulate matter, and especially we wanted to focus on PM 2.5, and ideally we wanted to get both PM 10 and PM 2.5. So this is these are 6 sensors that we looked at, and you can see from this table, they're fairly consistent. Like they all measured TVOCs, total VOCs, PM 2.5, PM 10, CO2, and depending on the particular sensor, they had perhaps a couple of other compounds that they measured. They used most of them used Wi-Fi plus a cloud-based dashboard, but one of the sensors used Bluetooth. And this is important, and this is something that we're paying attention to because in our populations, they don't always have Wi-Fi. In fact, they don't always have Wi-Fi. They don't always have Bluetooth. So we wanted to look at sensors for which data logging within the instrument was possible that could be then transferred to a flash drive and downloaded, as well as other kinds of technologies to meet the needs of the specific salons. And then the other thing I'll point out is just notice that the measurement interval is variable. And that's important because that's going to make a difference in the measurement that you see on the dashboard or in the app. So you're going to have differences in, in measuring this contamination in the same time, in the same space at the same time. You're going to have some variability just because of the different interval over which they're collecting that input and sensing the contaminant and then reporting out the concentration. We also wanted to look at the interface and the display. And again, in our case, in the nail salon and the beauty salon business is very client facing. Service is really, really important. Client perception and service is key. And these are low margin industries. So, they don't have a lot of wiggle room to get it wrong. And we found that depending on the salon owner and where it was located and a few other factors, some not necessarily defined, they were very sensitive to what would be displayed on that instrument or not. So sometimes some of them were very excited about being able to show that their environment was very healthy. Some were concerned that having something flashing numbers, especially if something came up that was red, that might really frighten their customers. So again, we paid attention to how these sensors operated. So this is the criteria here that has all of the information on the dashboard of the instrument. So there's no app required. There's no software to operate. Everything is right there. And then at the other end of the spectrum is the Atmo tube, which is that little black. So let's see if I can. Well, anyway, it's a little black thing, which shows no output on the instrument itself. The information is shown, and you can see it on the screen of the phone there. All of the information is shown through a phone app. And then the other instruments had, kind of in between that on the spectrum. So they had some output on their dashboard, but they all had some kind of cloud-based technology to provide more information and allow tracking over time. So in Tim's study, there were 3 phases. The first phase was in the exposure chamber in my lab. Phase 2 was in the salon and lasted about a week. And then phase 3 was a deeper dive into the data. So that was looking at one day's worth of data from the salon. So in the first phase, the objective was to gather baseline data across all of the instruments and then assess the baseline drift. And by comparing those, the output from those sensors with reference grade instruments, compare the accuracy of those sensors. So I don't think oh, there it is. All right. So again, for those of you who have been in the lab, you might recognize the TSI, the 2 TSI Track Pro and IAQ track, I think. One measures in the part per million range and the other in the part per billion range. And then the rest of these sensors are the ones that we evaluated. And so they were put in the chamber for a week with just passive ventilation, so very clean environment, no contaminant sources introduced, and just passive ventilation. And then with having the research grade, we had that kind of reference measurement there to compare against. So this is a graphical look at the output from Tim's work, and the reference grade instrument, in this case, the Q track, is in that blue shaded color. And then all of the other, you can see the key there with all of the other instruments. So in the first part of the graph, anyway, you can see that all of the sensors track more or less around that reference grade instrument. And, it does look messy. It looks noisy, especially at the end of this, but keep in mind that we're looking at a range of 0 to 0.5 parts per million here, and then only up to 1 part per million. So we're right at the cusp of the sensitivity of these instruments where they can detect. And I'll just point out here, so this instrument, so as the Q track started to drop, the levels measured drop down, this instrument actually started to increase. So that instrument is the Atmo tube. All right, and then we see that in our descriptive statistics. So again, just looking at that bottom row. So here's our reference data. And we see that the Atmo tube had the highest correlation coefficient, so most closely correlated, but you can see from that negative sign that tells us that it's an inverse correlation, meaning that as the Q-track levels dropped, the Atmo tube levels increased. So not great. And then we see also with the YooHoo, so these are the two ultra low cost sensors. The YooHoo had the lowest correlation coefficient and the highest coefficient of variation, so it was the most erratic of all of the sensors. But again, that being said, they were all, within half a part per million of where the reference grade Q-track was tracking. And importantly, we did not see significant drift across the week. The reason we had looked at that was that there was some information in the literature that suggested that these kinds of sensors tended to drift when they were in environments like salons where there were a lot of organic compounds. So we were happy to see that we didn't observe that drift. The second part of the study was in the salon. So the instruments were placed there for a week. And so this is a week's worth of daily fluctuations. And in this case, in this case, the reference instrument is that purple line. So we can kind of see it in the middle there. And all of the other instruments, the results from all the other instruments kind of all around those reference values. So what we saw was that all of the sensors followed a similar trend across the day. So they tracked around the reference instrument with both positive and negative biases. But in terms of kind of the trends following, they tracked. So that was good. Oops. Just one more thing to point out. So you see a couple of the outputs here from, this is the YooHoo and the Atmo Cube. I think they look like they've really flatlined. But in fact, in blowing this graph up, we see that they tracked with their reference instrument, but much lower. So, they're in terms of accuracy, they were not nearly as close as some of the other instruments. But in terms of the trend, when the others went up, they went up and so on, they did track. Okay, and we can see this in looking at the quantitative output. So the Kytera instrument demonstrated the lowest error of all the low-cost sensors. And the YooHoo, poor YooHoo is just not coming in dead lost across the board. The YooHoo had the highest error relative to our reference grade instrument. We saw that the Aware consistently overestimated the concentration, and the remaining sensors consistently underestimated the concentration. So this is really important knowledge because we can still use the sensors, but knowing that there is that bias in one direction or other, we can kind of, course correct. All right, so the last part of Tim's study was looking at a kind of a deep dive across the day. And this just really helped him look at, across specific work tasks and using specific compounds where there would be changes in emission rates to see how those instruments performed. So in this graph, the Track Pro is that purple line again. And we can see let's see, do I have it? Yeah. So we can see that the Aware and the Kytera recorded the highest concentrations and closest to the Track Pro. So they were right on either side of the reference instrument, with the Aware overestimating and the Kytera, did I have that right? Aware, yeah, the Aware overestimating and the Kytera underestimating. And again, the YooHoo and the other things follow the trend, but predicted much lower concentrations. So useful for following trends, not so useful in surveillance where we want to quantify what the exposures are. All right, so what did we learn from this study? Well, we found that all the sensors showed pretty good baseline consistency, but we did have some fluctuation relative to the reference instrument. So there were some differences there. Importantly, we did not see sensor drift. In phase 2, we found that the Kytera and Aware sensors had the highest accuracy and reliability. So those are the two instruments that we moved forward for our field work. And again, just noting that the Aware tends to overestimate the total VOC concentrations, and the others tended to underestimate. And we were focusing on VOCs because in the salons, there are a lot of organic compounds that are emitted into the air, as well as particulates. So okay, and the implications for this work, well, based on what we saw, the use of low-cost sensors supports their application to provide relative values and data trends, and then to map those trends, anomalies in hotspots to work activities and tasks. So these sensors can empower workers to make informed decisions about changes they can make in their own environment, like changing the ventilation, turning the ventilation on, chemical handling, product use, that sort of thing, because they can connect, when they're performing specific tasks, to changes in the air concentration of these pollutants. It also suggests that using these instruments to generate the data can support ongoing education and training in occupational health across the industry. Because we're getting real-time feedback, makes it a lot easier to tie specific tasks to changes in the environment. And I mean, if we could have that in the healthcare setting for antineoplastic drugs, no such luck. So having this application is really helpful. And then also these sensors would be useful for hypothesis generation. Okay, so how do we apply this knowledge to within a citizen science approach? So now I'm going to talk about current practices, gaps, and opportunities. The term citizen science means different things to different people. They describe it as having being a flexible term. And so depending on the discipline and how it's being applied within those disciplines, it can mean different things. So for our study, we defined citizen science as work in which anyone from a particular community was engaged. And then we had a very loose definition of the term citizen. And then we broke it down into 3 levels. So level 1, we describe as or define as community engaged. And this is the most engaged. So the community can be involved anywhere along the scientific process continuum. So from identifying problems and setting priorities to owning the data and advocating for change. Level 2 is community-based. So they may not be the ones to identify the issue or to set the priorities, but they're engaged in the research process at some parts. So maybe more limited, maybe a little bit later in the process, and they may or may not own the data. Level 3 we describe as community-placed, and that's where there's a research team that has identified research aims, they set up the study design, and they're engaging with the community as a means of getting access to the environment to collect that data. So much lower level of engagement. And to gain an understanding of the state of the science, we conducted a scoping literature review. I think I have time to talk a little bit about how much time do I have? Another
You've got at least 15 minutes.
Perfect. All right. So I'll just want to describe the lit review process a little bit for those of you who will be yet to do your scoping review. So this is a scoping lit review following the PRISMA guidelines. And so the first step in the process is to identify the databases that are to be searched. And so we have a kind of partially completed flow diagram here. We identified 4 different databases that would be relevant for the populations that we thought might engage in studies related to indoor air quality and possibly employ citizen science. And so from that first round, from the literature, we identified 106 papers. Of course, when you do that search, you get duplicate citations, so you eliminate those. That reduces the number a little bit. And then we looked at So we looked at the abstracts. The first step is always to do a review at the abstract level. And with the scoping review or with the literature review, ideally you're going to have multiple people engaged in reviewing the literature according to a set criteria. So here's our inclusion criteria, and then here's our exclusion criteria. So we had terms like air quality, air contaminant, community-based participatory research, radon, VOCs, and so on, to to identify papers that potentially should be included in the study. And then as a team, so we had a graduate student who was the student lead on this project, and she reviewed all of the abstracts. And then my colleague and I, Tran Nguyen, we split the data, the set of papers, abstracts in half, and then we each reviewed half of them. And then we used a tool to record our decisions on whether we thought they should be included or excluded from the study, and we were all blinded to one another's decision until the whole review process was complete. Then we removed the blind to see where did we agree or disagree, and then any conflicts were resolved through discussion about the particular abstract and the criteria. Then once that process was finished, we then started over again with the full paper review. So in this case, because Tran and I really wanted to become familiar with the literature, we actually agreed that we would both review the full data set along with the student. It was only 23 papers, so it wasn't that big of a lift. So we all reviewed all of the papers, went through the same exercise, blinded, and then removed the blind to see if there were conflicts. And then where there were conflicts, we met again to talk through whether those papers should be included or not. All right, so then our student took over to lead the analysis. And so with the full papers, she extracted information on the study type, the location, so both the geographical location as well as the building type, the contaminants that were measured, the citizen science level, and the sensor types, the sensors that were used for the studies. So jumping into the results, what did we find? Well, in looking at the levels of citizen science, most of the studies used a level two approach. So kind of a hybrid study where the community was involved, but they weren't leading the work. There were only a few studies where the community was truly, leading and involved at every step. Oh, and I'll just say with this, the studies that were level one were conducted in environments where they were actually conducted in occupational environments where there was already a kind of a physical structure, like physical organizational structure, and then work-based infrastructure. So there were people who had specific defined roles and a hierarchy there. Whereas with the residential studies conducted in residential areas, those were almost all level two. The majority of the studies were surveillance. So they were studies conducted to identify the presence of contaminants and then, at least to some degree, characterize the magnitude and variability of those contaminants, get a sense of spatial variability and so on. There were a number of studies that were focused on interventions, and some of the studies combined the two. There were several studies that did that. Just as an example of an intervention study, so one of the studies that was really interesting was conducted in Kentucky, and it was in a county where, and it's not a very old study. It was conducted in a county where they did not yet have policies that prevented smoking indoors. So smoking indoors was still allowed. And there was a community, and within that community, they had support from one of the local universities to help them conduct the study, generate the data, and then work with the policymakers to show them the evidence for how the indoor air smoking was harming their children's health. And showing that the exposures were occurring, and then because of the robust literature around exposure to secondhand smoke and the harms, they were able to advocate for a change in that policy, and they were actually successful. So it's a good news story all around. A few of the studies looked at sensor evaluation. So kind of that usability of, well, these sensors are out there. Can we use it in this kind of environment with this type of community? And then a few of them were specifically focused on advocacy. And those papers tended to be building off of the surveillance studies that had already been conducted, and then adding some or connecting some survey work to the empirical data, and then making those connections, being able to advocate for some kind of intervention or change in policy. As I mentioned, most of the studies were conducted in residential settings, and then the rest were split evenly between schools and industrial or commercial settings. In terms of geographic location, and looking at this map, you think, wow, they're pretty well distributed globally, and they are distributed across 10 different countries. But then when we dig into this a little bit more and look at the distribution within each country, we see that overwhelmingly the work is so far concentrated within the US. So lots of room for growth there. And similarly with the contaminant type measured, although there were a range of contaminants reported, overwhelmingly we saw that the studies made use of these low-cost particulate sensors. So a lot of measurements of PM, especially PM 2.5, but none of the studies had either sort of another level of analysis or follow-up studies to speciate that particulate matter. So we didn't get a lot of information. We didn't get any information about the composition of that particulate matter, and so that blinds us to the relative toxicities of the particulate matter. So as a summary of key findings from the second part of the work, we could definitely use more research in exploring best practices in citizen science for engaging with environmental justice communities for indoor air quality. An essential element of working with environmental community, this is true of working with any community, but it is especially critical with EJ communities, is you have to build that trust, and then you have to maintain that trust. And you really need to have your act together going in. Because if you make a mistake, especially if you make a mistake that could have been avoided, you don't always get invited back. You don't necessarily get a chance to correct that. So, this work is so important, and there's so much application for it. We really need to develop this. Also, research around navigating connectivity challenges and understanding how to leverage the tools that are available to us to best advantage. And then how to communicate technically complex results to different groups of people, often with language differences, cultural differences, lots of different kinds of challenges. That field is kind of wide open in terms of need. Of course, there's a lack of understanding of the chemical composition of the particulate matter that I mentioned. And we really need to understand that, because in order to link the health outcomes to the sources, we need to have more granularity there. And then there's a need for robust evaluation of intervention. So it's great to go in and make recommendations, make changes, but we really need a systematic approach to evaluating the efficacy of those changes, and also whether or not those changes are sustainable over time. So lots of work to do there. And so accordingly, since there's more work to do, we really should conduct studies over longer durations so that we can look at sensor drift over longer periods of time. Evaluate the reliability and the performance. Usability studies for both the sensors and the citizen science approach. What works and under what circumstances, and what are the best practices there? And then more evaluation studies so that we can understand which approaches are effective, and again, under what circumstances. So with that, I've provided some references for this for anybody that's interested, and I'm happy to take your questions.